Thanks everyone for joining us for today's Concussion Clarity Google Hangout. Dr. Jeff Kutcher, Associate Professor of Neurology here at the University of Michigan, will address your questions about concussion prevention, diagnosis, and treatment this morning. Dr. Kutcher is also the Director of Michigan NeuroSport, Team Neurologist of the United States Ski and Snowboard Association, and Team Physician for University of Michigan Athletics. If you haven't submitted your questions yet, feel free to tweet with the hashtag UMichTalks. It's at the top right of your screen, or email to umhsmedia@umich.edu. That's umhsmedia@umich.edu. We'll add new questions to the lineup as they come in. Today's chat will also be archived, so you can watch it at a later date or share with friends right at this webpage. Dr. Kutcher will start with a brief introduction to his research and clinical interest in athlete brain health.
Hello, good morning. Thank you for joining us on this Google Hangout today, talking about sports concussion. It's an important time of the year to talk about sports concussion, obviously, as school's about to start all over the country. Young athletes are starting to train and see physicians getting baseline tested, and we thought this was a great time to cover this topic in a little more detail for those who may need it. So our program, just a little bit about what we do. Michigan NeuroSport was founded 10 years ago. We've been in this business for a good bit of time. The NeuroSport program is not a concussion clinic alone. We do see concussion, we do see all problems of head trauma in athletes. But we are a sports neurology clinic. We are housed within the Department of Neurology, but we are truly multidisciplinary. We have physicians from multiple disciplines. We have a team of other clinicians, athletic trainers, physical therapists, neuropsychologists, really any profession that needs to be involved with taking care of patients, we have as part of our program. We also work hand in hand with our sports medicine department here at the University of Michigan. And so we understand that taking care of athletes, really, you need to have a team approach, and that's what we do here. We have been involved in research throughout the whole course of our 10-year existence, from very small projects to very large projects, things looking at what factors might contribute to concussion risk, what things might determine concussion severity, long-term health outcomes, equipment, monitoring devices, I mean, you name it. We've sort of been involved in those research projects. We also have a very active educational initiative where we go out and talk to the public quite frequently, be it parent groups, teams, whatever the situation may be. We understand that a lot of this topic needs to be covered in more detail than it has been. So that's just a short introduction to our program and what we do. You can get us online, obviously, at michiganneurosport.com, .org, sorry. And you can find more information there. Also, one thing I'll say is we do have an online sports concussion education course, modules online that do take people through a lot of information that is very important. And then at the end of the module, there is a certification process for coaches, for parents, and for athletes too.
All right, let's get to the questions. First question this morning: what's the appropriate age to allow contact in sports?
The appropriate age to allow contact in sports depends on a lot of factors. First would be the sport you're talking about. And then I think also the individual person, there's going to be some difference in maturity, muscular maturity, strength, coordination, athleticism as our kids develop. And so it's really hard to say there's one age that any one sport needs to follow for when contact initiates. What I would suggest is that we look at the bigger picture and think about why are we having these athletes go through contact activities, be it soccer or football or hockey or what have you. There are a lot of athletic lessons that need to be taught on how to play the game, how to handle yourself on the playing field, how to avoid injury. All these things are very important skills that need to be taught. And at some point in time, they need to be taught by experiencing contact. That being said, we don't want to be having kids go through contact solely for the purposes of teaching toughness or sort of as a punishment or a weeding out process. Those things are reasons that we shouldn't be having contact in our practices. And I'm happy to say that even though we have a long way to go, I've seen significant movement in those type of things being removed from sports. A couple of specific examples to highlight, I think, this concept. We think about contact in football. For example, it's really hard to play tackle football without contact. That is part of the game. The question is, at what age do we need to teach the contact part of tackle football versus the footwork, the other skill sets that are involved? So you can have a very active, rigorous training program and sport that can be played without contact in football, perhaps till age 12, 13, or maybe not even until high school. Those are conversations that are happening on a national level, and I think very, very critical to our kids' health. Hockey, I'll say as a contrast, if you're going to play hockey, full contact hockey in your life, and I did growing up, and I can tell you that one of the things that it is very critical to learn is how not to get hit, and how to protect yourself, and how to absorb a blow, and how to just be aware on the ice of all the things that are going on. So if we do not teach that to our kids as they're growing up, at some point they're going to have to learn that. And when is the best time to learn that? Is it when the forces they experience are maybe not that great, or is it later when they're even bigger? So it's a great question, and I think overall I would say we need to be careful to minimize the amount of contact that we have in all of our sports that is really just gratuitous, that is not there for any training purposes, and we need to be very thoughtful about how we approach that.
Okay, kind of piggybacking off of that, would you let your son play football?
It's a very popular question. I and others get that a lot, and I think the short answer is it depends. I think there have to be some things in place. Parents should be very aware of, for example, the coach's approach to contact. How do they practice? How much do they hit? Why do they hit? Are there athletic trainers available during practices, not only games, but practices as well? What is the concussion management plan, the recognition plan? To what degree is that even part of the culture that concussion is a serious issue and needs to be recognized? I think most importantly, all those things are very important, is the idea that concussions are important injuries to try and prevent and recognize and then treat appropriately. But what I think is more important from a long-term health perspective is monitoring the athlete's brain health over time, whether you're concussed or not, if you're playing a contact sport. So that, to me, is example as a team physician for the University of Michigan, when we have new athletes coming in as freshmen, my approach is I'm here to look after your brain health throughout your entire career here, so that you can go on for the rest of your life with a healthy brain. And I'm not just going to care about you when you're concussed. I'm going to care about you all the time. So I'm going to monitor things over the course of a week, a month, a season, a career, things like brain function and mood and sleep and those types of things. And if there's an overall approach, there is a critical thought process to monitoring how our contact sport athletes are doing over the course of the season. And then I think establishing a concussion and brain health care plan before it happens. And that's very, very important. I think especially in football, there's this growing and now very ubiquitous activity of baseline testing. Everybody's baseline testing this time of year, getting this information that they think will be helpful for concussion. I can tell you that baseline testing overall is a good idea. It is far more difficult to get good information than people realize, and it's very, very easy to misuse that information. So I would urge that people actually, as part of the, should I let my son play football or my daughter play hockey or whatever the question may be, think about the concussion care plan first. Who's going to see your child or yourself when you are injured? Make that plan. Think about that. Who's that going to be? And then talk to them and say, well, what kind of information would be helpful for you to have when you go through this process? What are you comfortable with? What are the tests that you know? I think all those things in place. I would let my son play football. Given all those parameters, I think it can be safe.
Okay, our next question from Dave, wondering about whether some people are more prone to experiencing a concussion. For example, if you have frequent migraines or you can't tolerate shaking your head, could that mean that you're more likely to experience a concussion?
Thank you, Dave, for that question. Again, a very common concern. And I think one of the things that we see all the time is that families will experience neurological symptoms in the setting of not only brain trauma, but other just movement, environmental factors in similar fashions. And what we see is that if there's a history of migraine in the family, whether or not, let's say the mother has a history of migraines or the father does, and the children may or may not have a history of migraines, but they seem to be sensitive to things. They seem to be sensitive to bouncing movements, trampolines, maybe moving in a car. They get car sick easily. Bright lights, flashy lights, sounds kind of seem to irritate them a little bit more. That's a very common presentation for brains that we would say are migrants would be one term, but really just more sensitive to the environment, and they will produce symptoms easier. Now, that doesn't mean that they're more easily concussed. And I think if we step back and realize that there are two parts of the process that have to happen for somebody to be diagnosed with concussion. There's this, I guess the easy way to think about it is, you get hit and it causes this concussion, which are the headaches and the sleep problems and all of that. But really, like I said, there's two parts to it. The brain has to experience enough force to be injured, and the injury in question we think of as a physiological state for the most part. There may be some very small cellular level changes that are structural, but the injury itself is one of performance. Think of it as a traffic flow problem or a software problem where the brain cannot do its job efficiently. That's step one, have enough force to cause the brain to be injured. Step two is there has to be enough injury to cause a clinical effect. And that might be a little strange to think about, but it's very true that brains are pretty good at being able to account for difficulties that they're having. If there is some insult, some injury, some disease process ongoing, other parts of the brain can take over. And so there's going to be a threshold in everybody. Well, two thresholds, really. There's going to be, one, the threshold of how much force does it take to cause this injured state, and then two, how much injury does it take to cause the clinical syndrome. And so it's that second part, that symptom threshold part, or the clinical syndrome threshold, that is much lower in people with migraine headaches, for example. Probably also other brain diseases or diagnoses like ADHD, anxiety. These are all brain network problems that are already there. And so it really takes less force, less injury, I should say, to cause the clinical syndrome. Now, it gives us a little interesting dilemma to think about this, because really the people that come into my clinic, for example, and say, oh, this is my 5th concussion, and everybody's concerned about that. That certainly could be a very significant, very bad number, or maybe not. Maybe it's because that brain is so sensitive that every time there's even a little bit of force, it produces a clinical effect. And which one is better for long-term brain health? Do you want a brain that is wired to more or less, throw the fire alarm switch easier, or one that can be injured and not produce a clinical effect and therefore continue to play when injured? So it really is, it's one of the reasons that taking care of concussed patients is very complex and needs to be done by individuals who understand brain function in its totality and can understand all the other factors that can go into symptoms. Certainly in this situation, Dave, I would say that people who have migraine headaches or in the family have migraine headaches, and there's a sense that they're more easily injured or producing symptoms, I wouldn't say that it's necessarily unsafe for those individuals to play football. It may not be the best idea in the world because they may experience frequent headaches and difficulties that really just affect their life. So I would take a good, long, hard look at that, think about that critically before really deciding whether a contact sport is right for that individual.
Okay. Another question deals with equipment in sports. There's always new safety equipment like headgear in soccer or the latest, greatest football helmet. What's your take on how much we should put our trust in this equipment, and how much we should follow what's the latest, greatest thing to come out?
Well, no doubt that equipment plays a critical role in so many activities, both organized sports, recreational activities. Helmets are critical for injury prevention. And I think depending on the sport, I would think about what the helmet's job is. So for example, in high velocity collision sports like football, I mean, helmets are first and foremost designed to and are there to prevent skull fracture and catastrophic injury. Most people are aware of why we have helmets in football. In the first place, President Roosevelt was responding to a national epidemic of college football students who were dying on the field from skull fractures and internal bleeding and very significant injuries, and helmets were kind of born to save football. And from that perspective, helmets do a pretty good job of that. Now, the problem comes when you talk about the more subtle and complex neurological problems like concussion and some of the long-term problems, because it's hard to really get a sense of how common those things are overall in the population. They're not as obvious as skull fractures, and we need to take that into account. So certainly, any helmet that lets less force through to the brain given the same exact hit than another helmet, I would consider to be a better helmet. Now, the problem is we don't know exactly what types of forces are the most quote-unquote dangerous for people. And they may also, different forces may have different clinical effects. At the case in point, if you have an impact, just a real quick impact, you're going to have a amount of force that's transmitted through to the brain. There's going to be a peak amount of that force. And a lot of the helmet designs and things that people have done is to try to minimize that peak force that's experienced. And that sounds like a great thing to do. However, if some mechanisms actually decrease that peak, but increase the duration of time that force is actually being transmitted to the brain, the overall area under the curve or the total amount of force the brain has experienced might not be less. And we don't know if neurons would rather see, a peak force of 100 Gs, for example, for this much time, or a peak force of 80 Gs for this much time. That part we don't really know. So I would exercise caution about particular claims by helmet companies, but I think overall, I think the companies are responding very well now. I think they understand this concept. They are starting to look at the bigger picture. I think there's a lot we can learn and a lot of things we can improve in helmet design. And I'm encouraged actually by what I've seen in industry and some of the companies that are responding to these concepts and making our sports safer. Now, other sports, so there's the obvious sports that need helmets: football, hockey, lacrosse. Then there's the other category of sports where it's sort of popular to think, well, soccer, for example, I'll put a headband on and I'll be able to be safer. Again, I think that's something that is not as straightforward as people want to make it out to be. I think in some ways, wearing a headband, for example, in soccer, can add a level of protection. I don't know that I haven't seen any published data that really prove that those headbands, for example, decrease the number of concussions people have. But as a clinician, if I have a patient who is, much like we talked about in the previous question, a patient who every time they get a ball that brushes past their head, hits them in a glancing blow or experiences any kind of impact, they might not get concussed, but they might have headaches. They might have some kind of external mediated process. I mean, those people probably would do well with some kind of protection, be it as minimal as possible. Of course, anytime we add equipment to athletes, we need to understand that we may be changing their behavior. They may be doing something differently on the field or on the ice, depending on what their equipment is. And so we need to be careful of that. The idea that if you put a headband on one soccer player, will he or she be more embracing to take more risks and go up in the air more frequently and be a little more aggressive? I've seen that. Not all the time, but I've seen that too. So I think like most of the answers today are going to be, we need to think about it very carefully. So I think I would be wise about how I spend my money on helmets, because you can sink a lot of money into things that may or may not provide a little bit of improvement. But I would look at it sport by sport, and certainly come in and talk to us if you have a particular question about a helmet. And we've looked at helmets. Patients have brought their helmets in, and we've helped them make decisions on these things.
All right. Our next question comes from Mary Lee on Twitter. What should a parent be looking for as far as concussions and monitoring their children?
So thank you for the question. I think the first thing, a concussion or concussions in general have a classic set of symptoms that most people could probably name: headache, sensitivity to light, nausea, fogginess, memory problems. Those can be obvious at times and sometimes not so obvious, especially in individuals who may be experiencing some of those symptoms already for other reasons. I think it's important for parents to really monitor any aspect of their child, any brain function aspect of things that may seem a little off, or may seem not to be reflective of how you think they should be doing. So subtle things like personality changes, typically would be reduction in energy and just feeling fatigued, and that would translate into kind of appearing depressed and withdrawn. Those are some of the more subtle things I would look for. To look for concussion itself, certainly sleep is a big thing that we see affected in concussion, both the first night after the injury, but perhaps for the next few nights as well. So if you have an athlete who is sort of not sleeping like they should be, it's at least worth thinking about and asking them some questions. I'm going to be careful here, because a lot of the symptoms of concussion really, like I said, show up in sort of the normal course of human existence. And so I hesitate to have people following their kids around and asking them every single moment how they're feeling, and looking at them and making sure, because you can actually, human psychology can actually create some symptoms in those settings. But I think it is important to think about overall brain health in your child and brain function. But again, I think it's important to not only think about the time period of concussion, but the longer time period too. Think about them over the course of the season, as the season goes on, as contact practices are starting to mount up. Get a sense as to whether things may be a little off for them in one way or another. And then also kind of take even a longer approach and think about how they've been for the last 2 or 3 years, how they are now, and then follow them forward into the future. Obviously, kids are developing and they're a moving target already, but parents typically have a very good idea of following that your child's development, whether anything might be a little off or not.
Okay. The next question, we'll take it actually from a blog you recently wrote at uofmhealthblogs.org about concussion myths. You talked about whether you actually should wake up a concussed person every 2 to 3 hours the first night. That's something widely talked about now. Can you address that?
Sure. Again, a very common question. Somebody who is diagnosed with concussion obviously had some kind of mechanical force that they experienced, either directly to the head or to the body. And in those situations, we certainly want to identify concussion, and it's a very serious injury to want to identify as early as possible. But there are other injuries that would even be more devastating, and quite specifically would be a bleed inside of the skull. And that's the idea of, do we need to wake somebody up every 2 or 3 hours, is to make sure that they are still arousable, that they still can come to consciousness. A concussed individual should be able, they may be wanting to sleep, but they should be able to come to consciousness and have a conversation. Now, the trick here is that the vast majority of bleeding episodes that are going to be emergent, life-threatening injuries will present themselves within a matter of a few hours, probably 4 hours or so. And this is just a general guideline. So I would recommend that anybody who's experienced a force and concussion is being considered or diagnosed, that they be in a situation where they can be directly observed for about 4 hours or so. If there's any question, of course, I would go right to the emergency room or call 911. But the idea of you need to wake them up that whole night, or for 24 hours they need to be awake, I wouldn't recommend that. And I think that actually could backfire a little bit. And in that setting of being concussed, brains need to start healing as soon as possible, and sleep is one of the things they do need. So waking somebody up every 2 or 3 hours for that first night might actually harm them from a concussion perspective.
Okay, the next question is, as a parent, how do you decide when enough is enough?
Another very common question we get and situation in our clinic is when do you retire from contact sports or sports in general? And I think this is a very important area, because it's easy for, I think, physicians and clinicians who are worried about concussions, who may not understand the injury and brain function to a certain level, to basically, kind of take, not the easy way out, but basically say, okay, you've had 3 concussions, next one and you're done, and because it's only sports, and let's just you stop playing. Why take the risk? That approach does not begin to show respect for the complexity of brain function, first off, in human symptoms and behavior, but it also does not take into account the serious negative effects that come from telling somebody they can't play their sport. Now, it's very common, in this day and age, for people to reference exercise and general health and the rate of diabetes in the country, and all that is very true and very, very important. But the idea that, just stop playing your sport, but you can still go exercise and be healthy, what that doesn't address is the tremendous amount of social development, personal development, physical and cognitive development that occurs from playing sports of all types. And when you have individuals who have played a sport from age 9 to 14 or 10 to 16 or 12 to 20 or what have you, and their brain has developed while they're playing that sport, and their personality has developed, and their sense of self has developed while they're playing that sport, and you tell them you can no longer play that sport, that has a tremendous negative effect on that person, on that person's ability to adjust, to be effective socially, cognitively, academically, and it's not a small matter. Patients will quite commonly then have more problems with sleep and depression and great start to slip. And then you hear, oh, well, maybe you should have retired sooner, and you should have retired the year before, and people don't stop and think about, well, maybe what's really the problem is they're not playing their sport anymore. And so there are times when it is definitely the right thing to do, to say, don't play your sport any longer, it's too dangerous. And all I'm asking people to do is to take that decision very seriously and understand both sides of that equation. Now, things that we look for to make that recommendation. So first off, the sheer number of concussions, only that variable is not enough to make the decision. As we talked about earlier, the number of concussions can be affected by a lot of things. Who's making the diagnosis? How sensitive is that brain to producing symptoms in the first place? So I often say that, the number of concussions, the only thing that really predicts is how long a clinic visit is going to be, because we have to talk about each of those injuries, and we have to get into what caused the injury, what symptoms did you have, and all the circumstances that go around it. So it's not the sheer number. However, if people are experiencing injuries sort of at an easier level, so it takes less of an impact to cause an obvious concussion, that would be an indication of a lowering threshold, a changing threshold. The brain is not responding like it should. And I think that situation is one that you would strongly recommend or consider reducing the exposure to impact forces. Now, the difficulty there is that's pretty difficult to determine whether that's actually going on. One of the things we do see quite commonly is that once you're diagnosed with concussion, it's a lot easier to be diagnosed with concussion again, whether you're concussed or not. People stop thinking, and they draw these obvious conclusions that any hit that causes a symptoms must be concussion without applying a more comprehensive thought process to it. But if you see somebody a physician who can actually think about all those factors and put that in larger perspective, and we identify a lowering threshold, that's reason number one, I would say, to retire from sports. Reason two would be is the activity that you're engaged in, changing your brain function in any kind of permanent way. In other words, the number of hits starting to lead to brain dysfunction that is not concussion, but is more an overall decrease in cognitive ability, worsening of mood, and those types of things. That is a very large concern, and it's probably the one that is talked about the most in the media. The stories that are on ESPN and HBO and other media outlets kind of drive that conversation. They get labeled as concussion problems, but they're not really concussion problems. They're the problems that come from long-term exposure to forces. So I think it's very important that if you have any concerns, again, that you see a physician that can help sort through all those different causes and symptoms and difficulties and do the right kind of testing and understand processes that lead to things like dementia. So any patient of ours that we think has some change in their brain function that we cannot attribute to anything other than that contact, we would recommend retire from their sport. The third reason, and this is by far the more common reason, goes back really to the first question almost that we talked about, which is, will continuing to play your sport just make your quality of life less than it should be, or less than tolerable? Contact sports certainly aren't for everybody, and there are some brains that are so sensitive that really just playing the sport isn't a good idea because of headaches and sleep issues, and we look at academic performance and social performance, those things start to be affected to a degree that it's just not worth it. So that's, again, not a frank safety issue from a catastrophic injury or dementia or long-term problem perspective, but it's really one of what are we getting out of sports, and what could sports be doing on the negative side of the equation. So those are the things that we would consider.
Okay, and we'll take one more question from Twitter. A viewer is wondering, have school forms signed by parents resulted in fewer concussion injuries?
Wow, that's a great question. Have school forms signed by parents resulted in fewer injuries? I think first, I don't know. I don't know of any data that would help us make that description. But I think from a theoretical standpoint, having parents, having them required to sign a form that indicates they've thought about concussion, understand a little bit about it anyway, and are giving their kids permission to play in these sports is an important step that shows that the community is engaged, the school is engaged, the parents are engaged in the process. And I think overall that'd be a very good thing. And I think it may not directly translate to fewer injuries, but I would think it would directly translate into better management of injuries and better recognition and better care. So overall, I'd be hopeful that's been a positive step.
All right, well, thanks for joining us, everyone. And this link will stay live, so you can watch the full conversation later or email it to your friends. Thanks again.
Thank you.